Hello everyone, welcome to my presentation. My name is hv3. Today I'm going to talk about SHOW. What is a SHOW? SHOW was defined by the National SHOW Foundation, which is a problem with blood supply to the brain. Do you know, according to the National SHOW Foundation, SHOW is Australia's second biggest killer after coronary heart disease and is a leading cause of disability. Every 10 minutes, an Australian will have a stroke. The acute exacerbation of ischemic stroke has many undesirable effects on patients and aggravates the burden on the healthcare system. In my next speech, I will highlight the pathophysiology of symptoms caused by ischemic stroke based on Mr. Ma's case study. First of all, I would like to point out Mr. Ma's clinical manifestation is severe right side weakness. In the case study, Mr. Ma was diagnosed with a left MCA ischemic stroke. The pathogenesis of ischemic stroke may be caused by arterial embolism. Thrombosis can form in the blood vessels in the heart or neck and travel through the bloodstream to reach the brain. The thrombus accumulates for a long time near the alveolus preagle. As the arterial occlusion progresses, symptoms gradually onset. Due to the interruption of the blood supply to the brain, the neurons that depend on oxygen and energy stop functioning within just 2 minutes and 2 seconds, few seconds, and begins to show signs of structural damage in just 2 minutes. Around the core of the stroke, the functionally damaged but structurally complete tissue forms a penumbra. Okay, so you can see here is a penumbra. In the penumbra, energy-dependent process failure occurs. Normal transmembrane ion gradient destruction, free radical release, membrane destruction, and inflammatory happened. Ischemic cascade. These changes can lead to apoptosis, which ultimately leads to motor functions impaired sensory. Besides, there are two sides of brain. One is left hemisphere, other is right hemisphere. The left side of the brain controls the most function of the right side body. Hence, the left side brain damage will affect the function of the right side body, therefore resulting in Mr. Ma's right side severe weakness. Secondly, I would like to point out Mr. Ma's clinical manifestation is right side facial droop. So what is the function of MCA? The MCA is the largest of the three arteries that carry blood to the brain. It branches off the internal carotid artery. It supplies blood to the outside of the frontal, temporal, and parietal lobes, basal ganglia, and internal capsule. First of all, I will explain that MCA supplies blood to the outside of the internal capsule, and then the damage of MCA will stimulate the internal capsule not to functioning. And the internal capsule is a white matter structure located in the lower abdominal of each cerebral hemisphere of the brain. It transmits the information through the basal nucleus, celebrating the caudate nucleus and thalamus from the putamen and globus pallidus. As you can see, the cortical bulbous leaves the internal capsule and enter the base of the pons. So you can see here, the cortical bulba tracts directly innervates the cranial nerve nucleus. Then it will directly stimulate the seventh cranial nerve. And the seventh cranial nerve controls the functions, controls the facial muscles. If the internal capsule is not working, then the facial muscle will relax, and the lesions involving facial nerves will cause facial expression muscle weakness on the affected side, which is Mr. Ma's symptom. Another key factor that I would like to point out is the incomprehensive words. So the MCA provides blood nutrition to parietal and temporal lobes. MCA infections will not be able to transmit blood to the parietal and temporal lobes, causing the lesions of Wernicke's area. So Wernicke's, as you can see here, Wernicke's here is located in temporal lobe and parietal lobe. And this area of the brain contains motor neurons involved in language understanding. In this case, the person will be able to pronounce but can use meaningless words and sentences. Since patients cannot explain what they're talking about, and they will not realize their mistake. And this is also called receptive aphasia. It is important to pay attention to the symptom of right hemianopia. The blockage of MCA usually results in a restriction of blood flow to the ophthalmic artery. The ophthalmic artery produces many branches. The ophthalmic artery provides blood to the eyeball and also provides blood to different parts of the eyes so the eyes can function normally. The central retinal artery is the first branch of the ophthalmic artery. The main visual pathway starts with the photoreceptor of the retinal, optic nerve, lateral nucleus of the thalamus, and finally ends at the visual cortex of the occipital lobe. Each of these functions structures plays a very important role in order to transform visual signals so that we can feel the visual perception of external visual. The obstruction of blood in the ophthalmic artery will cause the visual pathway to be unable to complete in order. And the visual field effects cannot be present. The patient will also be temporary hemianopia or permanent hemianopia. In conclusion, I would like to summarize the key points I said above. I talked about the prevalence of stroke in Australia, the pathogenesis of left MCA ischemic stroke, and the clinical symptoms of Mr. Mark caused by it include severe weakness on the right side, drooping of the right side face, right hemianopia, and the problem with language expression. Finally, what I want to say is, as a registered nurse, it is very necessary to understand the pathogenesis of stroke and to be familiar with identifying whether the patient has a stroke. If so, we need to take immediately action to treat the patient with a stroke, thereby reducing the risk of patient deterioration. Thank you for your listening. Bye-bye.